My name is Morgan Miller, and this is a public service announcement for STIs and pregnancy. An STI is a sexually transmitted infection that is caused by bacteria or parasites, and it is passed on from one person to another through sexual contact. This can be in the form of vaginal intercourse, oral sex, or anal sex. Common STIs are chlamydia, gonorrhea, hepatitis B, herpes, HIV, HPV, and syphilis. Common symptoms of STIs are sores or blisters on the genitals or around the anus or mouth, warts, vaginal discharge, which is foul-smelling or discolored, vaginal itching, pain with urination, pain during sex, vaginal bleeding, lower abdominal pain, rashes, and pain or swelling in the groin area. Pregnant women are not immune to STIs and can get them just as easily as women who are not pregnant. Pregnancy is not a protection against an STI. If a pregnant woman has an STI before she is pregnant and leaves it untreated, or gets an STI while she is pregnant, she's putting herself and her baby at serious risk. STIs can complicate a pregnancy and/or can be passed on to a baby as it is being born. Over 2 million women per year have an STI at some point during their pregnancy. If a pregnant woman knows that she has an STI or feels that she may have an STI, she should notify her doctor as soon as possible for further testing. The sooner that an STI is detected, the better the outcome. STIs such as chlamydia, gonorrhea, and syphilis can be treated and cured with antibiotics that are safe for a woman to take during her pregnancy. Viral STIs such as hepatitis, genital herpes, or HIV cannot be cured. However, in some cases, these infections can be treated with antiviral medications, or doctors can take other preventative measures to reduce the risk of the woman passing the infection on to her baby. STIs, such as syphilis, cross over the placenta and can infect a baby while it is still in its mother's womb. STIs such as gonorrhea, chlamydia, and genital herpes can be passed on to the baby as it is passing through the birth canal during birth. STIs such as HIV can be passed on while the baby is still in its mother's womb, while it is passing through the birth canal during birth, or if the woman decides to breastfeed, her milk can infect the baby with the STI. If a woman has an STI that can infect the baby while passing through the birth canal, doctors will usually not allow the woman to have a vaginal birth, but will instead perform a cesarean section. It is important to know that even though a baby does not get infected with an STI, there are still several complications that can happen and can affect the baby later in life. By having an STI during pregnancy, a woman is putting herself at risk for these complications: ectopic pregnancy, miscarriage, early onset labor, stillbirth, premature birth, the birth weight of the baby being under 5 pounds, birth defects such as neurologic damage, blindness, and deafness, the baby having chronic illnesses such as liver disease, cirrhosis, hepatitis, or meningitis, the baby having conjunctivitis, which is a serious eye infection, or the woman having a uterine infection, which can cause many other complications to her and the baby. In conclusion, here are some preventative measures that a woman can take to protect herself from STIs during pregnancy. Of course, there is always the option of abstaining from sex completely, and this includes vaginal intercourse, oral sex, and anal sex. If a woman chooses to be sexually active, it should be with a mutually monogamous partner who has previously and currently tested negative for STIs. She should also use a condom and make sure she is using a condom properly every time that she has sex. I'm Morgan Miller, and this has been a public service announcement for STIs and pregnancy. Thank you.